Right, welcome back. We are still on our Crack in the Morning, of course, being a Health Monday. Our focus of discussion today is on sickle cell disease or sickle cell anemia. Of course, in studio, I am with Millicent, who is a sickle cell warrior as well as advocate. And of course, I'm also with Dr. Deborah Omedo, who is a pediatric hematologist and oncologist. And if you're just joining us, of course, you can always go to our social media pages, that's on Facebook and YouTube, where we are coming to you live. And of course, you can just have the opportunity to have a look at what exactly we've been able to focus on and discuss as far as today's discussion on sickle cell disease is concerned. Daktari, to you, to someone who is just joining in, let us just give them as maybe a reminder to those who are still following over what exactly sickle cell disease is.
Yes, you're all very welcome. Sickle cell is a disease that affects the red blood cells. For people who do not have sickle cell, their hemoglobin, that means the red substance inside the red blood cell, is usually AA. And so when two people marry who have AA, all their children have AA hemoglobin. And so their red blood cells are very normal. However, it is said that because of the prevalence of malaria in the world, people who live in places where malaria was very prevalent, a mutation happened in the hemoglobin gene, and it brought the S gene. So you find that people who have AS, who are sickle cell carrier or sickle cell trait, do not get a very severe malaria. So it was like a way of protecting them from the very severe malaria. Unfortunately, if two carriers marry, they can get a child who has sickle cell. And sickle cell now causes all those complications that we had talked about. Yeah, so when you get sickle cell, the red blood cell is not shaped properly. It's not round as usual, but it becomes sharp and very sticky, and it can damage the walls of the blood vessel. It can stick together and cause blockage of the flow of blood and provision of oxygen to various organs, and it can also break down very easily, causing low blood levels and causing yellowness of the eyes and the urine and other complications like that. Yes.
All right. Talking of malaria prevalent areas, as you put it, would you say probably just from other than the gene being one of the causes or risk factors of a sickle cell disease, is a region also a cause? Would you say that? So
in a way, we find a lot more sickle cell in places where malaria is more common. In Kenya, for example, we find sickle cell much more in the lake region, that is Nyanza, western Kenya, and also in the coast province, where malaria is more frequent. But the truth is, sickle cell can happen to any tribe and any race. It happens in all tribes and all races. And it's just that in places where there has been malaria for a long time, the gene mutation happened to protect people from very severe malaria. And so you might find a higher prevalence of people living in the lake region or in the coastal region. But that does not mean that other tribes cannot get sickle cell. So to me, it should be universal screening, not just regional screening. And for sure, now we are a developed country. You can live in any part of the country. So we can't just say we are going to give the services only in Nyanza. Why someone from Nyanza can live in Garissa, can live in Molo, can live any other part of the country. So we should not restrict ourselves to only regionals. It should be a national thing, because anyone can have the disease, no matter which tribe we have. In the hospital that I work in, we have very many Kisii people with sickle cell. I have met many Kalenjins with sickle cell. I've met Maasai with sickle cell, many Luos, many Luyas. I've heard of Kambas with sickle cell. I've heard of Embus with sickle cell. We have Giriama people, Taita people. So basically, this is a disease of every tribe, and so there should be no stigma or saying that this is because of this tribe or anything like that. Anyone can have this disease, and the most important thing is to test early and to start clinic once you know the diagnosis. Yes.
All right, and now to you, Millicent, even as you continue sharing your journey as a sickle cell warrior, the previous time when I interacted with you some years back, you mentioned over your fears, of course, as a sickler. Yeah, you mentioned over the fear of getting married. You mentioned over the fear of maybe getting a child who is a sickler. Are the fears still there, or did something change? Even because as you were explaining before we went for the break, you just talked of how you've let me say evolved and even living fully now, even as a sickle cell warrior.
Thank you once again. Okay, I used to have fears, and each and every person in this life has got his or own fears.
Yeah.
Not only a person living with sickle cell anemia, but I, as a sickle cell warrior, I used to have fears. I used to have a lot of fears, but then I think I was not still in that. I had not still accepted myself fully, and I think that one depended on the clinics I used to attend, how I used to interact with my doctors. You know, there are clinics you go, or some doctors, usually they are there to discourage you, to tell you negative things. You know, people with sickle cell anemia, getting pregnant is not very easy with them. You can't, or you don't get married to people from the lake, people from, there are those discouragements. But as time went by, even as time is passing by, when I started becoming a sickle cell advocate, when I started to create awareness, because I knew when I share my story, I will encourage someone. More so, I like sharing my stories with the young ones, young children who live with sickle cell anemia, and then I always tell them, if I suffer from sickle cell and just have a look at me, I don't even look like a sickle cell warrior. Personally, I have never, I don't let sickle cell define me. I just define my life and God. Now, me, I always accept I'm a sickle cell warrior, or I suffer from sickle cell when I'm only in pain. Immediately I walk out of hospital and get out of that bed, I'm no longer a sickle cell warrior. I just came in as a normal patient, and I go to live my normal life. So I changed my clinics, and I changed the doctors I used to interact with. Now I got some doctors who give me hope. Apart from that, I got some groups where you get sickle cell warriors. That's why I call myself a warrior, because we have a group, a WhatsApp group, where we call ourselves warriors, because this is something we are fighting, and each and every day we are overcoming it. So in those groups, I get to interact with so many people who are suffering from sickle cell, and so you can see someone who is sharing a story. And some time back, my doctor told me, we have a sickle cell patient who has 5 kids. And so the doctor taught me, he said, the only thing you need to know is accept yourself first, and then whenever you find that you are pregnant and you are a sickle cell warrior, the only thing you have to do is walk the journey with the doctors and the gynecologists. Those are some of the things that doctors tell us. And so when the doctor tells you that, and you see your friends having babies, kids, they are getting married, you feel happy. And so you have to change that mentality. I can't do this, I can't do this. You just start working another new life, like I can live a normal life, I can get pregnant and bear kids. Yeah, I can be married. By the way, I changed my mentality, because I never used to love myself. And what used to hurt me most is how, when I find this person, how can I start explaining myself to him? Hey, most people just ask you your name, where you live,
what you like.
Now me, it is more of just knowing my name. And in our groups, in our WhatsApp groups, whenever we interact, we have a wall called the Super Women Warriors. You find some people there, they don't, I think they have not loved themselves that much. Now you will find someone saying, me, I can't tell someone I suffer from sickle cell. And then you get them asking questions. At what point are you supposed to tell this person you're dating that you suffer from sickle cell? You get some people saying, I can't say. Let that person find out on himself or herself. But personally, I will tell you, actually, you know my name. The second meeting, I will tell you, I suffer from sickle cell. I think it's good you share as early as possible so that you can't go far and then you tell this person, or maybe we'll find out from someone else. Because when you are dating, there are high chances that the person you are dating will find your friends. Automatically he will know some of your friends, and it is not good when someone finds something concerning you from somebody else. You know, the way he will take it, it's not the same way he will take it when I shared personally. No, I prefer I just share so that that person can make a decision. I don't want to go far so that I can get hurt. I don't want to hurt my feelings. I don't want to waste my time. I will tell you so that you can go and make your decision whether you are ready to live with me, because living with someone with sickle cell needs a lot of sacrifices and understanding, a lot of it. It is not someone who can just say it's just a disease, we can live. No, it's more than just a disease. So personally, I don't have any more fears. Even I got someone, I'm planning to get married soon. Actually, I'm planning my wedding this year, November. And yeah, and I'm inviting even all my fellow sickle cell warriors so that they can know, even I live with sickle cell, actually I can get someone who can love me and I can live a normal life. Yeah, people with sickle cell can live normal lives. We are entitled to marriage, to have children, to run businesses, to do anything. Personally, I try almost everything. And I don't want someone who discourages me. You can't carry that water. Let me carry it. Let me get sick so that I can know next time. The last time I carried, I got sick. And again, I will try again and again until I prove. Hey, nikibeba hiyo, I automatically get sick. Yeah, maybe I have never lived a life like I can't do. I can't. No, me, I know I can do. I can do everything. Yeah.
Wow. Thank you so much, and of course congratulations. I hope you're inviting me and Dr. All right, and Dr. Even as we look at the management bit of it, of course there is the perception as Millicent is bringing it out. There is how you carry yourself, believing in yourself that you can. In terms of management, you've talked over the medications as well, how to adhere to the medication. How about in terms of nutrition? Millicent had mentioned it earlier on. How do you manage yourself properly just to live your life fully as a sickler?
Okay, so a normal balanced diet is what is most important. So you need just a balanced diet with carbohydrates, proteins, fruits and vegetables. Sometimes I've come more and more people living with sickle cell may also have iron deficiency anemia at the same time. And sometimes the symptoms of that will be the person feels like eating stones, soil, charcoal, or just inanimate objects. And so that may mean that their iron levels are low. And that means sometimes they may need iron supplements and they may need an iron-rich diet. So long time ago, they used to find that the ferritin levels at certain blood tests called ferritin were very high in people living with sickle cell. And it was mistakenly thought that they have iron overload just because of that one test. And so they used to be told that a person living with sickle cell should never take iron at all. But unfortunately, it was found later on. It was found that this ferritin can go high because of inflammation of any kind. And remember, sickle cell, there's a lot of inflammation. So that high ferritin does not necessarily mean that you have an iron overload. Yeah, because you can actually be having less iron than you need in the body, and that you may actually need supplements for the same. Yeah, so they found that ferritin is not a very good way to measure iron. And nowadays, the way at least there are MRIs even in the government hospitals, they are finding like maybe MRI of the liver, the heart, might be a more accurate way to look for iron overload. Yeah, and so we hope that more and more people will be trained to be able to do that. So you can have iron deficiency even though you have sickle cell, and sometimes you may need to have the iron replaced. And but the main thing is just a balanced diet. Yeah, and hydrate. You need lots of fluids. You should not get dehydrated. So when you have a child with sickle cell, you want to be able to keep them warm, especially in this cold season. June, July will be a cold season. You want to make sure that they are warm enough. They have sweaters, they have socks, they have a kofia in the cold season. If you have electricity in the house, have a heater on so that they don't have to be exposed to cold. And then also in the extremes of temperature, when it is very, very hot, they should be able to drink enough so that they are not dehydrated. And they need to drink enough so they're not dehydrated. So things like very, very bad cold or very, very hot weather or dehydration, those can trigger crisis. Yes. Yeah. And then also, as she was saying, a sickle cell patient can still marry. If a sickle cell patient marries another sickle cell patient, all their children will have sickle cells. If a sickle cell patient marries a carrier, 50% chance of the child being a carrier, and 50% chance of the child having sickle cell. If a sickle cell warrior now marries someone who doesn't have the sickle cell gene at all their children will be carriers of sickle cell. Yes, and so that is usually some of the information that one needs to know, and so that you know how when you give birth, to make sure a child is tested in good time, and if they have sickle cell, make sure they are put in clinic in good time, so that they are managed well, and we minimize the complications in the child. Yes.
All right, and thank you for that. Of course, let us now look at of course, creating awareness about sickle cell. That's on 19th June, and the theme being bridging the gaps towards optimum care and control of sickle cell disease. What is your take on this, and why this particular theme?
Yes, so 19th of June is the World Sickle Cell Day. It's celebrated all over the world. This year's national celebrations will be in Vihiga County, but still even other people in other counties will still be celebrating in one way or another. Yes, so the theme about bridging the gap in care, as you have heard from Millicent, there's been some gaps here and there. The tests are not readily available very easily, and even once you know the test, not very many people know how to handle it well. So there is a need for us, for government to put in money to make sure that the tests are available all the time, and that medical people all over the time have the latest updates on how to manage the disease well, and make sure that the drugs are available. Sometimes it's so sad when you go to a hospital and you find the drugs are not there, the hydroxyurea is not there, the proguanil is not there, the patient has to buy it, and you find sometimes it's so expensive, and you can imagine the way the world economic crisis is right now, how difficult it is for those parents and those people living with sickle cell to buy those drugs. So government has to invest in people living with sickle cell, just to make sure that the drugs are available in every hospital, and that the personnel are very well trained with the latest way of especially handling hydroxyurea correctly. And when a person has a crisis, the oxygen is available, the drip is available, the blood is available. That means we need to have a very robust and well-working blood bank service in our country. And once we do that well, we will be able to, the people living with sickle cell will not get the complications, and they can be able to live a full and healthy life. Yes.
All right, and Millicent, you mentioned of how you, of course, create awareness in your community, talking to people in charge, talking to your fellow, of course, sickle cell warrior. As the world marks, that is a World Sickle Cell Day on 19th of June, do you have any activities planned, or what exactly will you be doing as an advocate of sickle cell?
Okay, as we are going to celebrate the World Sickle Cell Day on 19th of this month, where I go from my hospital clinics, we have a sickle cell match. We will be having a sickle cell match. Okay, we will be playing football. and we will be wearing on our t-shirts. I think we will be, some of us, warriors versus the normal people, like to show the world that we can play the football, we can do every little thing that a normal person does. And there is also a walk for Sickle Cell Kenya. It will take place from the Aga Khan Walk to Arboretum, National Focal Arboretum, and they will be talking about strengthening the sickle cell patients, to give them strength and hope. So we will be having that work. I think it is going to be led by Akuku Danger. Akuku Danger is the one who is going to lead us, and it will take place in the 18th of, I think, next Sunday. It will take place on Sunday. And we saw it better for it to take place on 18th, because 18th is a Sunday and so many people are available. So even as we are going to walk, we are going to let me call it preaching. So people will be seeing. There are so many people who don't even have knowledge that there is a condition known as sickle cell. Now with our t-shirts on, doing that work, people will just be reading sickle cell, work for sickle cell, and now from there you will get someone is very interested. I saw some people in town with white t-shirts. What is this sickle cell? And we want to create awareness. And even if we call ourselves warriors, there are some things that we have not still accepted. We are going to try to interact so that to know how to accept ourselves, because if we have not accepted ourselves first, we can't even create the awareness, we can't even give the hope to the young ones. Personally, I advocate and I create awareness in the slums, because more so in Mathare slums. You get in Mathare slums, there are very few people who have knowledge about sickle cell. Now, and when they find out that their children suffer from sickle cell, when they go to hospital and then they are being taught the management, the drugs, you know, people living in Mathare, how they struggle also with these economic times right now. They will reach to a point that they will deny those babies. You get to a point where you get fathers just tell the mothers, if it's not you, our baby could not have had this sickle cell, and the dad doesn't know that sickle cell comes from both of them. So we want people to understand, and when we are going to create this awareness, we are urging the government. My friends and I were discussing if it will be possible, at least we get at least 3 or 2 good hospitals that understand sickle cell, because there are some clinics you go, this clinic visit, you find a different doctor. The next clinic, you find a different doctor. He tells you different things. The next one, we just want a hospital that understands what sickle cell is and how they can manage the sickle cell. And we are urging the government to consider us for when it comes in the insurance parts. Now imagine you go to register for an insurance and you are told to wait for 1 year. Now it's like the insurers expect us not to get sick for that 1 year, so that you can start using that insurance after 1 year, and you have to get sick. So we just want a cover at least that will accept us with the pre-existing conditions, not only for sickle cell, even for cancer patients. And another thing, the prices of our drugs. You know, like hydroxyurea that Daktari is saying, there are some places a person can buy 1 tablet of hydroxyurea at 55 shillings. And you get a patient is, for example, me, I take 4 hydroxyurea in a day. Imagine I buy 4 at 55 and I'm supposed to take the hydroxyurea for 1 month, or not even for 1 month, for 1 year, for the rest of my life. You know, it gets to a point where you have to skip, because you have to buy food, you have to buy other drugs, you have to go for clinic. In that clinic there are tests. In each and every clinic you go, there are tests that doctors run to, so that they can know your HB levels. So we are advocating, or we are creating awareness, so that the government can at least lower the prices of the tests that we are told to go and run, even for the medicines that we use. For example, when you go to some hospitals and you are being covered by NHIF, but you're told blood transfusions you have to pay cash. For transfusion, for I don't know, cross matching, it's too it's too costly. So, and there are some drugs that we use like pethidine. You have to pay. In some hospitals, one pethidine costs 1,500, 1,000, depending on the hospital that you've gone. In public hospitals, you can get the painkillers, but before you get them, we call them utakuwa struggle. So they have to start you on Panadol before they get there. So we are urging the government, and even people, when a sickle cell patient comes to your office to look for a job opportunity, please just give them. And when we have to explain ourselves, personally, I can't just go attend an interview. Whenever I go to an interview and I'm contacted that I have been selected, I have to go and explain myself. Now I got to discover that after explaining myself, that chance is taken away from me, because they'll be like, she can't perform. No, we need to work, we need jobs, so that we can get money to take good care of ourselves. Yeah.
All right, thank you so much for that. And even as we wind up, Daktari, very briefly, Millicent is talking of course, even as the theme goes, bridging the gap up to optimize the control and care of sickle cell. She's talked of having hospitals that only deal with sickle cell. You see the way we have cancer centers. Do you think that is a place as a country we should be at?
So it is, to me, my thinking would be like that for HIV. In HIV, at first it was supposed to be a disease for very, very, very clever consultants and only professors. And remember, there's ARVs used to be very, very expensive. It was only the very rich who could get ARVs. And it was like a death sentence. If you have HIV, you should not even give birth. You should not do what? You remember that stigma that was there. But we saw how that stigma was reversed. We found that now there was a program that would now put good money in and make sure that everyone is trained, not only the professors, but even the lowest cadre, the nurse, the clinical officer is trained, and the diseases are provided for free. And the tests are done for free, and the guidelines are always, all the health workers are always given guidelines on the latest, and the clinics are available everywhere, from dispensaries to the most posh hospital. I think that is the approach that will be successful for sickle cell. Once we make it a program where testing is free or affordable, and that every hospital is sensitized, and every health worker, from a professor to the lowest community health volunteer or a nurse, and every dispensary hospital has got the drugs and they're available. That's when we're going to have good success. To me, I think that programmatic approach will be the best.
Wow. All right. Thank you for that. And any last words?
So many times I find families living with sickle cell, I find sometimes the parents suffering much more than the child. I've seen families breaking up. I've seen husbands and wives living in tension. I've seen some parents even committing suicide because of depression. What I would like to talk to you and tell you that sickle cell is not a death sentence. Sickle cell does not have to break your marriage. Sickle cell does not have to make you live in tension as husband and wife. Sickle cell, yes, it's a serious disease. Yes, it can cause some very terrifying complications. But if you accept it, and if you start good care, and if you love one another and support one another during the acute crisis and even during the chronic follow-up, you can live well as a family. You do not have to break your marriage. You can live well. You do not have to commit suicide. You do not have to be depressed. And you can see your child thriving. And even if there are complications, don't let those complications pull you down. Work together with the medical team. Work together with other warriors and put God first. and later even those complications can be overcome. Don't allow the complications to mess up your emotions, to mess up your spirit, to mess up your everything that you do in life. There is hope. There is hope. Sickle cell is not a death sentence. Handled well, the patients can live a good life.
All right, thank you. Millicent, your last words?
My last words, I could like to encourage people living with sickle cell out there. Let us love themselves. As I said earlier, healing starts with you. You loving yourself and knowing how to take good care of yourself. Let's love ourselves. This is a condition that it is there. We can't escape. Now that it is there, let us learn how to live with it. And I would like to thank our caregivers and even our parents for working with us this journey. It's not an easy journey. It's not an easy one. It brings financial constraints, emotional, spiritual, and maybe you find even your friends, the brothers to your parents, the sisters, they can't support you all through. There comes a time even when friends run from you because each and every time you're just there asking for help. Hey, today my daughter is sick, kindly help. They get tired. I just want to tell you that don't get tired. We love you. We love you so much for accepting us the way we are, and nobody should ever discourage you. Sickle cell patients or sickle cell warriors, I always tell myself I am beautiful. Actually, I do affirm myself each and every morning. I am beautiful. Every day is a blessing from God, and every day is beautiful. Be it you are sick, be it you are not sick, just live each and every day to your fullest. I want to thank my family for standing with me all along. May God bless you so much, even my friends. And as we are going to create awareness, let us even involve our friends. Personally, what I do, most of my friends knows I suffer from sickle cell. Joe, there are times maybe we are out with my friends, I have to tell them so that they can know whenever the pain comes, what they will do to help me. But if you don't love yourself and you don't create awareness about yourself and talk about yourself, people will not know. So I hope everything is going to work out well. When you are being told by somebody that you can't live beyond 18 years, I have seen people living beyond 100 years with sickle cell. They are having kids, grandchildren. I know it's only God who knows our lives best. So let us love ourselves, let us cherish ourselves, and let everyone be kind and loving towards the sickle cell patients.
All right. Thank you so much, Millicent. Thank you for sharing, and Daktari as well. Thank you for shedding in a light on sickle cell disease. All right. So that's where we end the health conversation this morning. Remember, we were looking at sickle cell anemia or sickle cell disease. Once again, we've been able to learn more of what exactly sickle cell is, of course, risk factors, prevention, and most importantly, management for those that are sickle cell warriors. So that was Dr. Deborah Omedo, who is a pediatric hematologist and oncologist, as well as Millicent Manga, who is a sickle cell warrior and advocate. Just to remind you once again, that's on 19th of this month, the world marks World Sickle Cell Day. Be part of this and be part of creating awareness. If you do not, of course, not in a position to create awareness, just be part of understanding what exactly sickle cell is. Of course, Millicent has been able to mention of some of the activities that they'll be part of. So if you're around Nairobi or any other county where you'll see an awareness being created of sickle cell, be part of that, and together let us understand what exactly sickle cell is. So thank you so much for tuning in. My name is Aida Muzati. See you again next Monday on another Health Dialogue.